I'm Dr. Charlene Wong. I'm a pediatrician, mom, and the executive in residence at the Common Health Coalition. I'm here to talk today about a concept that you might have been hearing about recently: shared clinical decision-making for vaccines. On January 5th, the federal government released a new childhood immunization schedule that shifted many vaccines that used to be recommended routinely, or for all children, to this relatively new type of recommendation called shared clinical decision-making. These include vaccines that protect children against COVID, flu, hepatitis A, hepatitis B, rotavirus, and meningococcal infections. So what is shared clinical decision-making? It's really just a decision process between a healthcare provider and their patient talking about the risks and benefits of vaccination. Of course, as clinicians, we already counsel our patients on vaccinations, and our patients share the decision about whether or not they want to get vaccinated. Here are 3 important things you need to know about shared clinical decision-making. First, there are multiple ways to do shared clinical decision-making for a vaccine. You don't need to have a longer or separate appointment for shared clinical decision-making. In fact, there's not a requirement that it needs to be done face-to-face, on the same day, or even by the same provider that's giving the vaccine. Second, many different types of clinicians are able to give vaccines under shared clinical decision-making. It's not just doctors. The CDC indicates that doctors, physician's assistants, nurse practitioners, registered nurses, and pharmacists can all do shared clinical decision-making. Some states have different regulations that allow more or fewer types of providers to do shared clinical decision-making, so check with your healthcare provider or medical board. Finally, shared clinical decision-making vaccines are still required to be covered by insurance. That means no out-of-pocket costs for patients. Together, we can help ensure that our patients, families, and communities have access to the protection of vaccines. Visit us at commonhealthcoalition.org for additional tools and resources for things like documentation and patient conversation guides.